This week, The Lancet, one of the world's premier medical journals, issued its annual report on the impact of climate change on health. This 36-page report goes into great depth on virtually every impact climate change has on human health. In this short video, I outline some of the key findings of the report. Climate change is undermining every dimension of global health monitored for this report, increasing the fragility of the global systems that health depends on, and increasing the vulnerability of populations to the coexisting geopolitical, energy, and cost of living crises that we currently face. Climate change is increasingly undermining global food security, exacerbating the effects of the COVID-19 geopolitical, energy, and cost of living crises that we currently experience. New analysis of 103 countries shows that days of extreme heat increasing in frequency and intensity due to climate change accounted for an estimated 98 million more people reporting moderate to severe food insecurity in 2020 than back in 1981 to 2010. Well-prepared health systems are essential to protect population from the health impacts of climate change. However, global health systems have been drastically weakened by the effects of the COVID-19 pandemic, and the funds available for climate action decreased in 239 of 798 cities studied, with health systems increasingly being affected by extreme weather events and supply chain disruptions as well. The report goes on to say that insufficient climate change adaptation efforts have left health systems vulnerable to climate change-related health hazards. Only 48 of 95 countries have assessed their climate change adaptation needs, and only 63% of countries reported high to very high implementation status for health emergency management in 2021. Increasing adaptation to climate change has the potential to simultaneously improve the capacity of health systems to manage both future infectious disease outbreaks and other health emergencies. But mitigation in the energy sector is crucial to keep the rise in global mean surface temperatures within the 1.5 degrees centigrade target set in the Paris Agreement. However, the energy sector is still heavily reliant on fossil fuels. Its carbon intensity decreased by less than 1% since the year the pact was signed, and a simultaneous increase in energy demand of 59% has increased total energy sector emissions to record high levels in 2021. Now, as countries seek alternatives to Russian fossil fuels, many are backsliding to coal, and shifts in global energy supplies risk a net increase in fossil fuel production and consumption. The slow adoption of renewable energies, which contribute to only 2.2% of total global energy supply, means that households remain vulnerable to the highly volatile international fossil fuel market, and millions lack access to reliable clean sources of fuel. Traditional biomass burning accounts for 31% of the energy consumed in the domestic sector globally, and for 96% of that in low-income countries. A new analysis shows that the air in people's homes in 62 countries exceeded guidelines for safe concentrations of small particulate air pollution in 2020. The current energy and cost of living crises now threatens to worsen energy poverty. A new indicator in the report this year reveals that on the basis of their existing production strategies and market shares, 15 of the largest oil and gas companies would exceed their share of greenhouse gas emissions that would be compatible with the 1.5 degree centigrade increase climate target. That would make the goals of the Paris Climate Agreement unattainable. In 2019, 80% of 86 countries reviewed had net negative carbon prices. That is, they actually provided subsidies for fossil fuel industries that amounted to a total of about 400 billion US dollars. These subsidies exceeded 10% of national health spending in 31 countries and exceeded 100% in 5 countries. Meanwhile, climate efforts are being undercut by the profound scarcity of funding. A health-centered response to the coexisting climate, energy, and cost of living crises provides an opportunity to deliver a healthy, low-carbon future. Transitioning to clean energy and improved energy efficiency can avert the most catastrophic climate change impacts while also improving energy security, supporting economic recovery, preventing the 1.2 million annual deaths resulting from exposure to fossil fuel-derived particulate pollution, and improving health outcomes by promoting active forms of travel for greener cities. The associated reduction in the burden of disease will in turn reduce the strain on overwhelmed healthcare providers and enable better care. Now, the report does state that not all the news is bad. In response to the restrictions on fossil fuel caused by the war in the Ukraine, many countries have started to look at renewable energy to provide a bigger share of their energy usage. Thanks for watching. Please share this video with your friends and relatives, and take some time to view some of my other climate-related videos. If you haven't already done so, I'd be honored if you would subscribe to my YouTube channel.